This portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
Joining us live in studio is Dr. Mark Hiatt, Executive Medical Director of Regence Blue Cross Blue Shield of Utah. It's always good to have you, Dr. Hiatt. We've got some interesting topics this morning. We've heard a lot about the opioid epidemic, and how has this recent study quantified the magnitude of this epidemic?
Amanda, there was a recent study just released this past Friday by the Blue Cross Blue Shield Association, and it found that 1 out of 5 of its subscribers fill an opioid prescription each year.
That is amazing to think that 20% are doing this. Is there an area that's more pronounced?
Yes, Kent. It's more pronounced in the South and the Appalachian region, but really this epidemic stretches across our country, and it does not spare our state of Utah.
So what can be done?
Really, Amanda, there needs to be some collaborative effort involving medical professionals, insurers, employers, communities, and the patients themselves. We really need to ensure that patients are getting the right medication that they need at the right time to safely control their pain.
That is amazing to think that 20% of people are getting those prescriptions.
Kent, an even more amazing statistic to me is that there has been a 500% spike in opioid use disorder diagnoses over the past 7 years.
Wow.
That is a sharp increase.
All right, let's change topics and talk a little bit about the algae bloom on Utah Lake. And we talked the other day to a fella who works down there in Utah Lake, and he wants everybody to know it's not as big as it was. But there is some algae bloom down there. So we should talk a little bit about the places that are affected, should we not, Doctor? Because this can be something that can affect people.
Yes, this algae bloom has been spotted by satellite imagery in the Provo Bay area of Utah Lake. And this is the second year in a row in which there's this algae bloom on Utah Lake.
But the concern should be modified a little bit, right, to just the area of the lake that it's spotted. Is that correct?
Yes, Kent. So far, fortunately, this bloom doesn't appear to be as widespread or as serious, at least at this point, compared to last year. There are signs advising people against recreation in the Provo Bay area of Utah Lake. Those signs have been posted, and it's really just those areas that need to be avoided.
So the point here is that the lake is open, and the lake is there for recreational purposes, but where there is a sign posting, avoid those areas because of the concerns
because there is a health effect.
Yes, and just to these limited areas, there's this limited chance that people could face the harmful effects of the toxins that these algae produce. And these toxins can cause symptoms such as diarrhea and vomiting.
See, I wasn't thinking of that. I just thought it's sort of mucky to be around, but there really is a health effect. Watch out for diarrhea and vomiting. Okay, I want to ask you about these new trends for pregnancies, which are so interesting to me. So teen pregnancies are down.
Yes, the teen birth rate dropped about 10% in 2016 compared to the previous year.
That is good news. Now, is there another trend, though?
Yes, there is. Interestingly enough, that the rate of births in older women has actually been increasing.
So what do you attribute that to? Is there any reason?
You know, a lot of women are just deciding to have babies later in their lives. And in fact, the birth rates are indeed rising among women in their 30s and 40s.
I'm always fascinated by that. Thank you, Doctor. It's good to see you as always. This portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.